Our government committed to supporting Canadians during the pandemic, and that is exactly what we are doing. We will continue to always work collaboratively with provinces and territories to ensure that together Canadians get through this difficult pandemic. I would now like to invite my colleague, Anita Anand, to say a few words. Anita.
Thank you so much, Dom. Good afternoon, and thank you for joining us today. I have a brief update on the deliveries of vaccines to Canada. Since negotiating the early deliveries of vaccines in December, Canada has now received more than 6 million doses of vaccines to date. In fact, Canada's shipments of vaccines over the course of the next 3 months are expected to match the total number of doses received over the course of the past 3 months combined. That is 6 million more doses coming to Canada between now and April 18th. Les livraisons de
Canada's shipments of vaccines over the course of the next 3 weeks are expected to match the total number of doses received over the course of the past 3 months combined. That is 6 million more doses coming between now and April 18th.
In the doses that I just mentioned are the 1.5 million AstraZeneca doses from the United States that I can now confirm will arrive in Canada this coming Tuesday by truck. We have said from the beginning that the first quarter of this year would represent a period of increasing supply as vaccine manufacturers ramped up production, and this would be followed by significant supplies coming to Canada. We are now seeing that supply surge, and it is set to continue. Pfizer is providing at least 1 million doses a week from now until the end of May. Moderna is increasing the frequency of its deliveries from every third week to every second week, with 855,000 doses shipping the week of April 5th and 1.2 million doses shipping the week of April 19th. That is 6 million doses from Moderna and Pfizer alone in the month of April. Nous voyons maintenant une forte augmentation.
We are now seeing a supply surge that is set to continue. Pfizer is providing at least 1 million doses a week from now until at least the end of May. Moderna is increasing the frequency of its deliveries from every third week to every second week.
With Moderna executives yesterday. They assured me that their second shipment will come a few days later than expected due to temporary circumstances relating to the quality assurance process. As mentioned, we remain on track to receive 855,000 more doses from the company the week after next as scheduled. At the same time, as manufacturers stabilize their production lines, we are closely monitoring the global environment, including export restrictions in a number of jurisdictions. Our officials across numerous departments, as well as our suppliers, are working ahead of time to ensure that Canada's vaccines continue to arrive in our country. Not only have all the necessary export permits been secured for next week's shipments, but Pfizer has already received the necessary approvals for the shipments taking place the week of April 5th. Beyond seeing these doses coming to Canada, they also are being administered at increasing rates. Yesterday alone, 190,000 Canadians received a vaccine dose. 11% of the Canadian population has received at least one dose so far. Given the profound period of global demand for vaccine, there will continue to be bumps along the way, and we will continue to work every day to ensure that vaccines arrive in this country. As we have seen, these bumps are temporary and have not knocked us off course. And as I mentioned earlier, during the next 3 weeks, Canada is scheduled to receive the same number of doses that we have received over the course of the last 3 months, and this schedule will continue to accelerate. Indeed, my work every day is to bring as many doses of vaccine into Canada as early as possible. This is exactly what my team and I will continue to do until all Canadians who wish to be vaccinated have access to a vaccine. Thank you. Merci. Miigwech.
Merci beaucoup, Anita.
Thank you very much.
Now.
Merci. Nous allons donc passer à la période de questions. Toutes les questions aujourd'hui sont au téléphone.
All questions today are on the phone, and we would ask you to limit yourself to one question and one follow-up.
Don't take questions. All questions today are on the phone. As a reminder, we ask that you limit yourself to one question and one follow-up question. Nous allons donc prendre la première question. Opérateur, c'est à vous.
Thank you. Merci. La première question, l'inaudible.
First question, Lina Zib. Please go ahead. Yes, Monsieur Leblanc. My question is for you, because you're the one who's there. There's the CBSA Border Officers Union that is telling us today that in the last 2 days, 8,000 people have crossed the land border for a Passover. And I was wondering what you would say about that. Is it only tested Canadian citizens with a quarantine plan who are crossing? And can that be a guarantee that nothing bad is going to happen? Answer. As you know, since the beginning of the pandemic, the government has been putting in place restrictive measures to protect the health of Canadians. We have added layers of protection with additional measures at various times based on the advice of scientists and doctors. People who are going to the land border entrance places must, as you know, have a negative screening test that has been performed within 3 days before their arrival at the border. They are also subjected to other measures such as screening tests upon arrival and quarantine measures. If there is an increase in volume of Canadians who want to come back, because as you know, the law does not allow us to turn away a Canadian who arrives at a land border wanting to come into Canada. We are going to ensure that all of the necessary measures remain in place, they are not changed, to make sure that all Canadians' health is protected. So can you guarantee that the 8,000 people we're talking about are Canadian citizens who cannot be turned away? And Ms. Anand, I don't know if you have an update to give us on the Johnson & Johnson vaccine and what is delaying any delivery date for that. So, Lena, I will talk a bit about the border officers, and Ms. Anand can answer the question about vaccines. The rules haven't changed. No tourism is being allowed over the border with the United States. So it's not Americans who are deciding to come to Quebec or Canada for a weekend vacation. The border is still closed to tourists. Essential workers and Canadians or permanent residents who arrive at the border controls, the rules for them have not changed. There has been no change of the rules. So if Canadians decide to come back to Canada for one reason or another or to cross the border, they will be subjected to all of the necessary measures that have been in place for a number of weeks and months to ensure that the health of Canadians is protected. So there has been no change. There has been no loosening of measures. The obligations are the same. We are not going to change those measures in the coming weeks either.
Prochaine question. Oh, no, sorry, Minister Anand.
Un moment. Oui. Merci beaucoup.
Yes, thank you very much for the question. I recently spoke with a supplier, Johnson & Johnson, in order to get a delivery schedule. And we've been told that we will get that information, and we understand that it takes time to plan to integrate a fourth vaccine into the province's vaccination programs. But we will provide the information as soon as we get it. Thank you very much.
Merci. Donc, nous allons passer à la prochaine question. Opérateur, c'est à vous.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, good afternoon, Minister. I'm wondering about the Moderna delays. I know you said last night that it has nothing to do with the EU export restrictions. I'm just wondering if you can go into any more detail about the assurances you received from the EU that they're not targeting us when they target to reduce shipments.
Well, thank you so much. On the subject of Moderna, I specifically raised the issue relating to the EU with the supplier yesterday, and Moderna confirmed that the delay of a few days is not related to EU restrictions. They have had those doses already cleared to come to Canada, and they will be arriving next week. And in terms of the EU itself, we're continuing to speak with our suppliers as well as our ambassadors. As you know, the Prime Minister also spoke with Ursula von der Leyen to express the importance of continuing to receive Canada's doses. That is doses that we have contracted for already into Canada. And as you can see, Ryan, the proof is in the pudding. We're receiving 3.2 million more doses next week and 6 million doses between now and the 18th of April. Thank you.
Yeah, just as a follow-up, I'm wondering if you sort of advised the provinces, obviously this delay hit this week. I know it's short term, but, there's vaccine nationalism, there's production delays, there's all kinds of things that can go wrong when it comes to deliveries. Have you advised provinces to expect this rollout to be bumpy at times, to see ups and downs from week to week, even if there's sort of a steady flow of vaccines?
Well, I will respond, and then I'll ask my colleague Dom LeBlanc also to respond, since he is the Intergovernmental Affairs Minister and speaks regularly with the provinces. But the reality, Ryan, is that this is a period of intense global demand for the same product. And as a result, what we have seen the worldwide is that countries are competing for vaccines. In this process, Canada is utilizing its diversified portfolio of vaccines to pull vaccine from multiple sources: Belgium, Spain and Switzerland, India, the United States. That's part of our strategy of diversification in order to manage the bumps that the international environment is presenting to us. We are working every single day to ensure that the vaccine doses for which we have contracted continue to arrive into this country, and that's exactly what you're seeing. The acceleration of doses from Q2 to Q1. We will end next week with 9.5 million doses in this country. 36.5 million doses prior to the end of June and 118 million doses prior to the end of September, because of the aggressive approach that we are taking every single day, staying on top of this file and managing the bumps along the way. Dom?
Thank you, Anita. And perhaps I could also add, our daily contact with provincial authorities around vaccine logistics, around the rollout and the ramp up, as Anita said, for the increasing number of millions of doses that will arrive in Canada over the next few weeks. This is an ongoing, active conversation daily. General Fortin and his team at the Public Health Agency of Canada have regular and ongoing planning meetings with provincial authorities. We recognize that as some of these inevitable ebbs and flows in terms of weekly deliveries occur, it's important for the provinces, as best as is possible, to have the latest information, to have visibility on when and how many doses will arrive in Canada so they can plan, obviously, the most effective and efficient rollout. So this is a very positive and ongoing collaboration. Obviously, when we receive news of changes or adjustments that are typical and that we had said would be an inevitable part of this global ramp up. As we receive that information, we immediately, obviously, pass it along to the provinces and work with them so they can do the most effective planning possible. And our information and our experience has been to date that the provinces are well prepared, are effective, have a series of redundancies in terms of their own ramp-up plans. So we're very confident that this will all go very well.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. Prochaine question, Julie.
Next question, Julianne Lapointe. Question. Yes. We heard today that really it's a fight of vaccines versus variants. And there are all kinds of unexpected things that could happen. As you were mentioning, there are bumps in vaccine delivery. So how can we ensure that vaccines will get the upper hand? Answer, I'll start, and maybe Anita can add something, Julianne. So as we've said from the beginning, the global aspect of vaccine supply will necessarily lead to adjustments from one week to the next. That's the case for all countries in the world, as Anita mentioned. All of these countries are looking for the same vaccine. So that's why Canada, as we've said a number of times, made a conscious decision based on the advice of scientists and of doctors to have a diversified portfolio, not just focus on one country, one contract, to be able to vaccinate Canadians in the greatest numbers possible and as quickly as possible. Our government's goal is to do just that. It's a goal that we share with provincial governments. Dr. Tam and others who are responsible for public health in the provinces have said that the quicker we can get Canadians vaccinated and the more Canadians who accept to get vaccinated, the easier it will be to control the arrival of variants. That hasn't changed. I think that we are doing a good job in terms of getting vaccines into Canada as quickly as possible, and the provincial authorities are doing a very good job in getting those shots into people's arms as quickly as possible. And we want to really make sure that all Canadians who want to get vaccinated will be able to. Anita, would you like to add something? Yes, thank you very much, Dom, and thank you for the question. First of all, Dom is right. We are going to strengthen the resilience of the vaccine supply chains into Canada thanks to diversification. With more than one supplier delivering vaccines to Canada, we are able to stay on course despite turbulence, if you will. There's always volatility in global supply chains. And despite that, vaccines are still arriving in Canada. So this week, Canada distributed over 6 million vaccines throughout the country, and over 3.2 million more doses should be arriving next week. So that's the progress we're making, but it's our work as well. And every day we are working on this to make sure that all Canadians will get vaccines. Follow-up question? Yes, perhaps for Minister Leblanc. Your region, the Atlantic region, was mentioned today as being for its response to the high number of variants. So how can you explain what's happening with these variants? Are the provinces doing enough? Do you think that the measures should not be loosened? So if you talk about New Brunswick, my province, well, there, I think that it's a success story. We were able to get a handle on variants and restrict the number of COVID cases. And that's true for all Atlantic provinces. So I am fully confident that the provincial public health authorities will make the right decisions. In the northwest of New Brunswick, there was a change in the alert level because there was a possible concern about variants. And in Newfoundland, we saw what happened when a variant arrived there. It made the number of COVID cases spike. But then we also saw that the authorities of Newfoundland were able to get a handle on that situation. So to answer your question, I am fully confident that provincial authorities throughout the country have what it takes to make the right decisions to protect their population. Thank you.
Prochaine question.
Thank you. Merci. Next question, Glenn McGregor, CTV News. Your line is open.
Thank you. Minister Anand, despite what you've said about exports from Europe, it still is uncertain in the future. And can you tell me what kind of conversations you've had with Pfizer or Moderna about that possibility that exports would be restricted from Europe, what they would do in that case to fulfill their contractual obligations to Canada? Is there any possibility that it could be directed from somewhere else? Is there a possibility of supply coming from the U.S. directly?
Well, thank you so much. And Glenn, you're exactly right that this is an issue that we're watching very closely, as we must and as we should, given that there are new developments in the EU. Having said that, we are directly engaged with our suppliers to, first of all, ensure that our doses are ready to leave Europe. They're clearing the export control restrictions that Europe has set in place to enable them to leave Europe. And that's exactly what we have been able to manage with our suppliers. The doses have continued to arrive since January when the discussion of European restrictions began. And indeed, going forward, we've been assured that the doses have been cleared to leave Europe for next week and the week after. But again, it is a situation that we have to watch very closely given the intense global competition for vaccines. And as you suggested in your question, all options are on the table at this point. You have seen us, in the case of AstraZeneca, for example, pull that vaccine from multiple locations, from the Serum Institute, from this deal with the United States government, from our bilateral arrangement, from COVAX. We are diversifying all of our options at this point to make sure that we are going to continually receive vaccines into Canada from approved suppliers. And that is the work, as I said, that I do every single day and will keep doing until we have sufficient vaccines in this country.
We haven't heard a lot in the last couple of weeks about Johnson & Johnson, and could you give us an update on where discussions are about supply, when, how many doses could be expected, and when they would arrive, and whether or not they would be in any way impacted by European export controls as well?
Well, thank you for the question. And I have repeatedly stressed to J&J the importance and necessity of Canada receiving a delivery schedule as soon as possible. We are set to receive J&J doses in the second quarter and the third quarter of 2021. We are in total going to be receiving 10 million doses of the single-shot vaccine. The precise delivery schedule is one that we still need to receive and, if necessary, negotiate, and we will anxiously await receipt of that delivery schedule.
Merci. Thank you. Next question. Prochaine question.
Thank you. The next question is from David Thurton, CBC News. Line open.
Hello, ministers. I hope everyone is doing well. I wanted to ask about the situation that's happening in Brazil. Yesterday, we saw over 1,000 cases. The death toll is the second highest in the world, possibly set to overtake the U.S. And the variant of concern that was found there is, of course, at play. So I just wanted to know, what is the Canadian government doing first to protect, Canadians, and also help curb the situation there?
Well, so obviously, and we've said this since the beginning of the pandemic, it's a global pandemic. So as we've seen, if it's in Europe, if it's in North America, in South America, there have been at different moments over the last number of months, very difficult circumstances. And Brazil is an important country. It's a large country. It has a big population, and they have suffered a great deal. It has been difficult in Brazil in terms of the impact of COVID. That's why countries around the world, including Canada, have had to stand up measures at our borders. And Canada has some of the toughest border control measures of any country. We have, from the beginning, had this 14-day obligatory under federal law quarantine for anybody who comes into Canada. We have closed the borders for non-essential travelers. So we've stood up testing requirements before one would board a plane to come from Brazil or any other country to Canada. We've increased measures at the border around testing at the point of arrival. The quarantine measures have remained in place. There have been some, including the Conservative Party, who think we should be loosening these measures, who are asking questions all the time about why aren't we reducing or eliminating important measures that we've put in place based on the advice of doctors and scientists to protect Canadians. So we obviously share the concern of all Canadians about what's happening in Brazil, but there are also a number of countries around the world that are also facing difficult circumstances, and that's why it's important to keep in place all of the measures necessary to protect Canadians, and we'll continue to do so for as long as it takes to ensure that every possible safety measure is in place.
David, do you have a follow-up?
Yeah, but does Canada need to do more? Do we need to take stronger measures? Argentina, we're hearing, is closing its border. Do we need to adopt measures that not only protect Canadians, but also send a message to the Bolsonaro government that what is happening there, that treating this like the cold or a flu is not acceptable?
Well, obviously, the obligation for the government of Canada is to focus our energy on protecting Canadians, on protecting the health of Canadians, on providing the economic supports that are essential for Canadians and Canadian businesses to go through COVID-19, to support provinces and territories so they can provide the best possible health care necessary to protect Canadians in every part of our country. So our primary and most important focus is on what's necessary to protect Canadians. And the government of Canada has responsibility for international borders. And that's why, as I said, we have put in place very restrictive, very effective measures based on the best medical and scientific advice we have. And we'll continue to improve those measures and leave them in place for as long as it takes to ensure the safety of Canadians. I don't think Canadians would find it particularly constructive for the government of Canada to go around the world and point the finger at different countries of what they may have done or may not have done. Our focus is very much on what's necessary to protect Canadians. And obviously, like all other countries, we want this global pandemic to be brought under control and to be behind us in a global context as quickly as possible, because that's also in the safety interest and the health interest of Canadians to ensure that COVID-19 is under control and eliminated in every part of the country. But our focus has to be properly on what we need to do here in Canada to ensure the safety of Canadians, and that's exactly what we're focused on all the time.
Merci, thank you. Operator, next question.
There are no further questions registered at this time. Il n'y a plus de questions à ce moment-ci.
Merci. Donc, étant à la fin
So that concludes the questions and therefore the press conference for today.